Hello, everyone. Welcome to You Matter Voices in Healthcare, a podcast brought to you by the Power of Providers and Washington State Department of Health. I'm Anita Chopra. I'm a physician and faculty at the University of Washington in Seattle. I'm an internist and one of the lead physicians at the Long COVID Clinic.
And I'm Dr. Carrie Perkins, a medical anthropologist and qualitative researcher with the Washington State Department of Health. Today, we're so glad to be joined by Dennis Worsham, Washington State Secretary of Health, someone whose own story of service and resilience began decades ago on the front lines of the HIV epidemic. Over his more than 30 years in public health, Dennis has led through countless challenges, always centering compassion, collaboration, and a deep belief in community. From his early work supporting the LGBTQ plus community during the AIDS crisis to leadership roles in King and Snohomish counties, and now at the state level, his work has consistently centered on equity and hope. We're honored to have him here with us today to talk about what it means to lead through change, to care for the people doing this work, and to sustain our sense of purpose in this process. Welcome, Dennis.
Yeah, thank you so much, both of you.
Dennis, you've had such a long and distinguished career in public health, most recently leading the Snohomish Health District before accepting the role of Washington's Secretary of Health. It's an honor to have you in that role. What motivated you to take on this role, and how has that shaped the way that you lead?
Yeah, thank you so much. One, thank you just so much for inviting me to your space and to giving you a little bit about my own experience and my own journey about my love and commitment. How many of us in life get to be able to do a job that is actually aligned with our work and our purpose? And I feel so blessed and fortunate to be in this space and to be in this role currently and to kind of carry that work forward. So yes, I was in Snohomish County. I've been in, as you noted, in the public health system for about 32 years, the governmental space, and beginning actually that journey in Snohomish County. And what really, my degree is actually in health services administration. Thought I was going to go that particular route. And as I was wrapping up college in that degree, I also was at Eastern Washington University and had helped start their first student health program. It was the only four-year university that didn't have student health. And I ran on a platform for student government to actually start that student health program. And after 2 years of being student body president and getting support to do that from our administration, I was actually hired to stay on and begin that student health program, and it's still running today and really addressing access to student health in a place where it was much needed. We had an older age student at the time, and two things that they needed. One was access to healthcare. The second one was childcare. And I had this brilliant idea as a college student is I was going to defund the athletic program and I was going to fund student health and childcare. And you can only imagine how well that played with the politics of the university at that time. So what took me to Snohomish County was I was also in the process of coming out as a gay man. And it was really important at that point for me to wanting to give back into a community in which I was coming out. And really, we were in the height of the epidemic. This was in the early 90s. And Snohomish County had a position open as a health educator and a community mobilizer to really work around HIV and AIDS. And as we think back to those times, which seems so long ago, it was a time when the federal government really was standing in a place of not providing the services and or access to care to gay men who were dying. And it invoked a passion in me to step into that place and to be a voice from somebody coming out into this space as a gay man and wanting to do something to give back into the community in which I was giving out. And that was really empowering. I always tell the story. We would start every staff meeting on Mondays with reading the names of the people who died that week in Snohomish County of HIV. And every name that was written, and we would place a flower in our atrium of a remembrance of that person, it just connected me to the purpose of why I wanted to do the work I was doing and to give back and to save lives. And it just really was deeply embedded in me of who I am. and really began my public health journey. As you both know, as physicians and familiar with the public health practice, there is a science and medical model in public health, but there's also equally as important a community part of the model. And it was important for me to bring the voice of the community with the science and the health and the medical model, and to really do what we could to really save lives and change the trajectory of that area. I've continued my journey, went down to King County, as you mentioned, did a lot of work around equity and other things, but I ended up going back to Snohomish County. Was in a role of leading the COVID response in King County, and I was burned out. And I know part of this podcast is really addressing some of those areas. But, when you're in a place that politically is hard, and I know we're going to get to some of these dialogues further, I was kind of thinking maybe I should just go do something else. And after I stepped into the interim director role, we hired the new director in King County. And Snohomish County was moving from an independent district into a governmental structure with the county government. And I was asked if I'd come back and actually be a part of that mission. And kind of like your first date, I fell in love with public health in Snohomish County and wanted to go back to the place that it actually all started. And what I didn't expect is I fell in love with public health all over again. When I left there in 2005, there were over 300 employees, third largest county in the state of Washington. And before COVID, they were down to 106 employees. They'd lost 2/3 of their workforce. And here is the county who had our first COVID case in the United States, and combined effort around our first death in King County. And they did a marvelous response with 106 people to that first response with all national eyes on them. So I went back up and led them through that process of getting reintegrated back in, understanding morale was low, and one, coming through COVID, two, being what they felt was a takeover, but it was really the right decision to come into the county government structure and to really help navigate that system with them and really provide a space of leadership. I was going to end my career there, start there, in there, kind of bookend it in Snohomish County, and had set a plan to kind of do an early retirement when I turned 62. Fast forward, Governor Ferguson gets elected, and I start getting some phone calls of interest about, do you want this job? And I was pretty clear and adamant that I had a different plan of retirement, but thank you for thinking of me, and it was an honor, but no. And I said that no a few times. And I was then took a vacation. Another podcast we could do about too much screen time. I was sitting on a beach with my husband celebrating his birthday on a beach vacation, and I started watching the executive orders roll out. And boy, it just took me back. It took me back to the very place that I started my public health career, is the federal government stepping into a place of really denying access. The attacks around DEI, the directs around public health started to roll, and something shifted in me. And it's kind of those moments where it's a fight or flight moment. And I decided I had one more fight in me. And so I had a recruiter call me, and I said, I'm in. And I'm going through the process, and if I'm selected, I'm committed. And as we know, because I'm here with you today, I was given the opportunity, and I'm really humbled by the opportunity. But it really was stepping back into a place of understanding of 32 years of being committed to access to care, public health practice, and the commitment we have to serving people who are furthest from optimal health was under attack again, just like the federal government was when I first joined public health. So that's what brought me to this back to this role.
Great. This is such an inspiring story. And I think the highlight of this story is I had one more fight left in me. I love that. I love what you said. And I think that all of us in healthcare, somehow every day we come to work and think, I have this fight in me.
I have this
And
fight in me.
I think this was very inspiring for me. I hope that you write a book one day and you inspire younger people who are entering this field. And, there's so much that they can learn from your commitment to public health and just your passion to make a change.
Thank you so much.
I think it's so deeply relatable about seeing, as you were talking about these changes rolling out, changes in federal funding, that people feel that deeply and personally, especially when you've dedicated your life and your career to
Yeah.
public health and you see those changes. And it feels so deeply personal. And I think that response that I'm not just going to leave, I have fight left in me and I still want to fight for these things that I believe in, I think is so powerful. But I want to go back to something that you said a little bit earlier when you were talking about both low morale and burnout. And we know that many health professionals, in the wake of what's happening federally, but also in the wake of COVID and some of these other emergent
Yeah.
issues, have really experienced burnout from things like workload or instances of moral injury, staffing shortages, or even just administrative demands. What are you hearing from providers about these pressures, and how do you think that the Department of Health can play a meaningful role in supporting that workforce?
Yeah, thank you so much, Carrie. Yes, so as you know, I've been on a listening tour, listening, learning, and then we're gonna lead a tour, and this is coming up everywhere. I think as both the healthcare system and the public health system, that we really gave everything that was in our souls to this COVID response. And we wanted to assure, just as I did early in my career around the HIV pieces, that everybody had the access that we needed to get the service they needed. Everybody would have access to that prevention that they needed around vaccines and education. And we wanted to make sure that we could interrupt this transmission and people dying. And it was tough. And I saw, during the COVID response, I was over the infectious disease program in King County. And then for a year and a half of my time during COVID, stepped into the director role. And I saw our team work endless hours, and I saw the healthcare side work endless hours. And I also saw the tolls that took on people. Uh, People who were physically tired, people who started to manifest their own health concerns physically and mentally, saw depression, and all kinds of things really play into our workforce. And it meant a lot to me as how do you rebuild? How do you really support people where you're at? Um, in the healthcare system, it's the same thing. And I think what made it even more difficult is it became polarized through some of the politics that all of a sudden health and public health really started getting politically in the center of the COVID response. And that also had a huge impact because it isn't something we have experienced to that level in my career anyway, to really feeling that. And I think that that also really played into people's moral health. One of the things I have been saying to people as we've been out and about in our role is and I know we're going to do a rapid round at the end about things that inspire us, but one thing to know about me is I generally have a theme song that I kind of have, and sometimes they last for weeks, sometimes they last for months. And one of those, when I moved from the role of over the infectious disease program into the director role, extremely tired a year into the process of COVID. And my song became Andre Day's Rise Up. And she says, I'm tired, I'm beaten up, I'm, where I'm at. And one of her lines in there is she says, we have hope because we have each other. And it really was important to me to understand that in my own journey of getting back to this place of taking care of my own health and the health of my team was that we always had to lead with hope, and that this would pass, we would get through this, and we were doing the right things for the right purposes, and our jobs were actually the work of what was importance at the time. And I think it's important for us to be connected to that why and to keep hope into those conversations of where we need to continue to move. I also say to people, having watched it firsthand within the public health system, is there's so much stigma around mental health. And when you are in a service created environment like public health and healthcare, is we're even more sensitive to say, I need to take a break. I need to take care of myself. It feels selfish, and it's hard to step back and to make sure our own health is in good place before we lift others in that good place of health. So I really want to always put that emphasis out there, is sometimes encouraging people to step back if you need to step back and to take care of yourself. I think about the game that you play as a kid. Maybe you guys played it. It was called it was called, Red Rover, right? And you would have everybody brace their arms, and they would call the person over, and they would try to break the line of where we need to go. And I think about that image of holding hands and holding arms to hold the line as best we can. And so my message to people is, if you're tired, take care of yourself. We're going to hold the line until you can come back and join us. And once you can hold that line, once you want to come back and hold the line with us, come back and we'll fight with you for what we need to do and bring the morale where we need to go. But we're trying to bring hope to this conversation. We're trying to get people connected back to why we're in this work to begin with. Reassure people this will pass, and there's hope beyond this, and to not get so caught up in what's going on in the microcosm, but to really keep the macro of where we're going. And our role in this society is really important. And people who have the poorest health outcomes need us more now than ever, because those disparities of health are only going to get greater if we don't hold the line. So keeping that vision is really important.
Yeah, thank you. That's a really powerful visual, I think, of us linking arms, right? And then creating that net, that tension that is going to hopefully keep us together. And I also like what you said about community. And I think it's important for us to be visible to each other, that you see that strength, that we see each other, that we are all working towards the same goal. And that visibility kind of reinforces, I think, that strength and that resilience as well. Yeah.
It's so important to hold the line together. I think that's the essence of, the community that we are, because, we have each other to lean on as well in these difficult times. And it is,
Yes.
I really feel that in my own practice, I constantly lean on my colleagues. I lean on my medical assistants, my clinic manager, my chief of the clinic. I think that having those relationships is extremely important
Yes,
for us
absolutely.
to feel inspired and to feel like we are making a difference. It's like a sense of validation. I think that's very important.
Thank you so much.
And Dennis, I want to change tracks a little bit and
Absolutely.
talk about slowing down. You've emphasized slowing down, explaining the why behind decisions,
Mhm.
and rebuilding trust in public health. How do you see healthcare providers contributing to that process? How can we help? And what steps can DOH take to strengthen trust with communities in partnership with them?
Yeah. Yeah, I've thought a lot about this a lot over the last little bit. And there is so much misinformation that's out there, and I do think we have lost some trust through the COVID response. And part of it becoming politicized is what has reinstated that with the misinformation that's out there and available. And I think that when I think about our COVID response as a system, and I mean that as the public health and the healthcare system working side by side, is we just had to move, right? We had information, we had to make decisions quickly. How are we going to interrupt this transmission? How are we going to curb death? And do we need to close down schools? Do we need to close down work environments? What do we need to do that's going to protect the area? And we were making decisions very fast in order to be able to save people's lives, literally, and to interrupt transmission of disease. And I think about prior to COVID, that we, as a public health system and a healthcare system, oftentimes people would say, um, let's apply a public health approach. It didn't matter if it was around transportation or incarceration. People started using this terminology even outside of the public health world about a public health approach, because it was such a trusted community and process in which we did our work. And now we're on the other side of COVID, and now there's this sense of not trusting who we are and the work that we do. And I think, again, part of that is, the politicalization, misinformation that's out there. And I do think we have to slow down a bit. I think about in our public health practice, if you look from the 1920s to currently, right, is we have made over 20 years of progress of life expectancy. And that has really come through really strong medical and public health interventions, from vaccines to injury and violence prevention to sanitary to clean water. A whole bunch of public health practice is where we gained that trust. And I think we're going to have to slow back down and really remind people of what we do in public health and the outcomes of what we've done in public health. And I think we're going to also have to slow down and say why we're doing what we're doing currently. When we just did the West Coast Health Alliance, it was really important for me to be in front of the media and to say, we're doing this because, and really tie it back to science, to our medical community, to Academy of Pediatrics, ACOG, all those really strong medical communities of really around where the science was and getting people clear. When we did the standing order, it was really important to say a standing order is a prescription. That's all we're doing. We're writing a prescription so you have access in your pharmacies without having to go to your doctors to get a vaccine. That's why we're doing the standing order. If you're still not sure, talk to your doctor, have a conversation. And I think we're going to have those kind of intentional, slower conversations and allow some dialogue in those places in order to rebuild trust. And our outcomes will get us there, because they always have in public health. We deliver good practice, we intervene, we make our communities healthier. We just have to rebuild those conversations, and they'll start, at a relational level through dialogue.
This is so important what you said about trust. I think for patients, it is an opportunity to deliver or get better health care. And
Yes.
physicians can deliver better health care if there is trust. And then patients can feel more empowered and aware, and their ability to assimilate the correct scientific information increases, and they can dispel myths, they can tell the untruths, what is the truth, what is not what is not the truth. But for the other side, for physicians, I think it helps us build our own professional identity when we
Yes.
establish that connection of trust. I often have my students, with me in clinic or even during our community outreach efforts. And what I can see firsthand is their professional identity being developed there out in the community as they are building trust. So,
Yeah, Dr. Sherber, if I could just say one thing on the medical side, and I think that this is an important part of us on the public health side as well, is, I choose my provider by somebody I feel comfortable with. And that comfort comes from me sitting in space with that provider and having that provider see me for who I am and what my values are and what I have. And we have that dialogue one-on-one. And that's how that relationship starts. And that's how the trust then unfolds going forward. And I think what I'm trying to do is take that model in the public health side, and it starts at a relational level, right? When I show up in Eastern Washington, where I was born and raised, in the small town of Othello in Adams County, which is predominantly Republican, and I show up and I say, I get it. I grew up here. I understand. I'm one of you. And let me tell you about my own journey, is that trust happens because there's a relationship. And just like in the provider relationship, public health is going to have to get back in and get to that relational level that we are going to really change things in the long term.
Yeah, I agree. It's so important to meet people where they're at, I think,
Yes.
and showing up and actually making making that commitment is deeply symbolic, and it says a lot about, the commitment to doing this work.
Yeah.
Um, I wanted to go back a little bit. We mentioned your listening tour, and you talked a little bit about some of the themes that were coming out of that tour being related to burnout and how people are managing that. Are there other themes or stories that you're hearing from healthcare workers during that listening tour?
Yes. In the listening tour, when you're a newly appointed position like the one I've stepped into, the first question out the door is, what are your priorities?
Mm.
And what I have learned, and in my own journey, right, I came in at a front door entry level position in public health. And what I learned through my journey is the importance of taking time and listening with people who are closest to the work and what they're experiencing before you make any decisions about where you're going to go. So it was important for me to set a framework. In the framework that I have set in this listening tour are 4 areas of focus that I'm trying to get input on. And one is, how do we strengthen the governmental public health system? And when I talk about the governmental public health system, it's really local public health, it's state public health, it's tribal health, and it's the state board of health. That's the governmental public health system. When I talk about, then the other area of focus is, how do we strengthen the healthcare system? And that is also tribal health. That's hospitals, that's clinics, that's behavioral health, that's whole person health in those particular spaces. And what can we do to strengthen that system? Because public health has 2 pillars. We have our traditional public health side, but we also have on our other pillar is really around healthcare. And if I were to say our pillar is about protection, promotion, and prevention in public health, on the healthcare side, it's really about quality, it's about access, and it's about affordability. And the other part of this work is, in the listening tour, is then how do we work together across those 2 systems to improve health equity, or what I'm calling health justice. And the other one is, how do we then work with our team, which we've addressed here, around burnout and supporting our workforce through this really difficult time. Thing I'm hearing is there is so much fear in the system right now. We're seeing funding cuts. We're seeing Medicaid cuts that have already passed. We expect 250,000 people are going to lose access to their Medicaid. Another 150,000 are going to be priced out. We're talking 400,000 people. I said in critical access hospitals in Eastern Washington, where over 60% of their payer mix is for Medicaid. And they're like, what's going to happen? What's going to happen about aging in place, serving the communities where we're at? What are we going to do? So I'm hearing a lot of fear. The public health side, same thing. We see this dismantling of the public health system, from data to infrastructures of funding. And what do we really do in this particular area? And I think it's the call to action, going back to this visual of the holding the line, is how do we come together to really think about, are there opportunities in this place to really do some innovative, good work that we need to do? And I think that's going to move us to the action plan. But there is a hunger and a need for people not to feel isolated in their professions, and thinking about how we build the momentum. And if we can bring tribal health, physical health, behavioral health, public health, and for me, also equally as important, people who we serve, people in the community, to the table to think about how we're going to move through this time, is going to be really, really critical in what we need to do. I'm hearing things from data integrity. And where is data going to come from that really drives what we do? That's both on the healthcare and public health side. I've heard about how do we around vaccines, vaccine preventable diseases, as this war on vaccines and integrity of vaccines is starting to, the healthcare providers are asking for help, because if we, for example, start seeing, which we have already within the last year, is that as people aren't getting their COVID vaccines, or aren't getting their flu vaccines or their measles vaccines, is it puts greater pressure on the systems of the healthcare response. If people lose their healthcare and don't have a primary care doctor, and they're using emergency rooms for their primary care, is putting more stress on the system. So the question is, on this continuum from community to tribes to public health to healthcare, is what is each of our role, and where can we really support each other in really getting through where we're at. So we're going to be developing kind of an action plan based on several of these things coming through, and how do we strengthen these systems individually, but also collectively.
And I'll just add in, over the past couple months, I've been interviewing sites that host our caravan mobile clinics. I've been talking to working groups that work with people with lived experiences of homelessness. And I'm hearing very, very similar concerns of uncertainty, of worrying about, vaccine availability, what this is actually going to do to communities when they don't have access to these services. And so I would really, just reinforce what you've said, is that I think that these themes are absolutely real.
Yeah.
And I also liked the fact that your commitment and the DOH's commitment to inclusion. You talked about tribal health. I think that is so very important for all of us to be together, to be inclusive, and to not leave any groups behind. We have to be mindful of all these different groups. And, I think that when all of us are safe, then each one of us is safe. Dennis, across your career, you've had to make hard decisions under pressure, and I don't really envy your job, especially during, public health emergencies like infectious disease outbreaks.
Hmm.
Healthcare workers face similar pressures every day at the bedside and in their communities. From your perspective, your experiences, what helps people stay grounded, keep their sense of purpose in those high stress moments, and also keep their motivation, not give up?
Mm.
Yeah. Yeah. As we talked about a little bit earlier, I'm a big believer getting connected to why we're in the field to begin with, is certainly an important part of that. I also think it's important in this space is not to get isolated from being away from the people that we actually serve. And that is a motivator for me is, it's easy for us in our public health world or in our Department of Health world is to become insular. And we start working only with other people in public health or the healthcare system, and we get further removed from the people we're actually serving. And I find that if we can stay connected to the people who need us the most and understand what their needs are, it's a motivation for us. But there's also a reaffirming the services that we are providing, how important it is for people who are receiving those particular areas. I'll give you one example, and it's kind of insular, but not. Is when we made the decision around the standing order, right? It was quickly. We had to make it quickly, and we made the decision based on FDA with the COVID vaccine coming out that it was only going to be available. Their recommendation was for 65 and older, which takes anybody who's under 65 off label. And when you're off label, then it takes that prescription in order to be able to get that. And we know in the state of Washington, we have nearly 60% of people who are getting RSV, flu, and COVID vaccines are for pharmacists. And taking that access away was really important to address really immediately. So we did this prescription standing order approach. I heard from one of our own staff members who has a special needs child who has some healthcare issues, and family members who live with this child in this ecosystem of family dynamics. They live in Idaho, and they were not able to get a vaccine for the rest of the family to protect the health of this kid. The kid could get a vaccine, but the rest of the family wasn't eligible for a vaccine. And she had to load up her family, drive to Washington to a pharmacist, able to get their whole family vaccinated to protect their kid that they couldn't do in their own community in Idaho. And it's just a good reminder that we made that decision quickly for important reasons. And as soon as you hear that story come forward of a family that benefited from that, it then motivates you to say, we're doing the right thing. We got to keep doing, no matter what the pressures are, no matter what the rhetoric is out there, people are benefited by the decisions we make for their family and for individuals. And that's always a good motivator for me.
Yeah, absolutely. I mean, it's just understanding there are real people behind these headlines, behind these numbers, and it affects people on such a granular level. Yes. So when you look back over your career, also kind of thinking about how your career has spanned over 3 decades now, is there a moment that really stays with you when you thought, like, this is why we do this work? This is why this is important? Or is there a time when you saw public health or healthcare make that real sort of impact?
Yeah, I've had many of those moments, to be honest. Of course, we've talked about my HIV journey, which probably made it most real for me because, I saw so many people die. And to know that we were helping people who were scared, confused, and it's weird and hard coming out as a gay man, right? I was in my late 20s, early 30s, and I started even believing myself that if I make it to 50, it will be a miracle. Like to have that become a community norm
Yeah.
around people you die is really impactful. And to be able to change that narrative and to support people through that process and give them hope and the tools that they need to have the best health they have. I think about, the time when this is, again, a different population, but a similar thing that is also just gave me like pride in work we were doing. I became a program manager for TB and serving people with tuberculosis. And generally, those are foreign born people who come from high endemic areas that we're able to really help provide services to. But in my role there, we had a major outbreak in our homeless population. And again, a population that is historically marginalized, and we oftentimes don't even make eye contact with when we're out on the streets ourselves. And how we needed to change the outcomes of getting people the treatment that they needed to be able to do. And I remember a really sweet moment where we decided, based on my HIV experience, we were going to bring people who were living unhoused out to dinner. We had a white tablecloth dinner, and we set our homeless populations who had been impacted by TB and wanted to hear from them directly about what they needed and what services they needed in order to stay compliant to the medication. Because as you know, as a doctor, that's a long journey through that medication process. And they gave us clear things. And one of them was that getting to Harborview up the hill was a really challenge when at that time, the free bus zone didn't take you all the way up to Harborview. And so we ended up setting up a clinic downtown in one of our homeless shelters and actually were able to provide those services. And I was like, this is what public health does, right? We listen, we learn, and we provide services to the people and meet them where they're at. Carrie, you made that very comment earlier, and it really was a good moment. And I think about those opportunities where we have brought people in who were struggling in other topic areas, and we listen to them and we really create systems. And I'm just like, every time those moments happen where you talk to a person who's behind that challenge of illness or disease, is coming up with a solution that is co-created with community and people who are most impacted, reminds me of like, these are cool moments and this is what public health does.
I could not have said it better. I'm so in agreement with you about this co-creation of knowledge and bringing people to the table to have that conversation. I read this book over the summer that was called When We Walk By, and it was by a guy named Kevin Adler. And he's talking about, this aspect of our culture that doesn't even allow us, that where we often don't make that eye contact, right? When we are just ignoring these systemic problems because it makes us uncomfortable. And it was about sort of confronting the things that make us feel uncomfortable as the only way to actually implement systemic change that's sustainable. And it's such an important conversation to have. And so I thank you for verbalizing that in such an eloquent way. If you can believe it, we're actually close to the end of our questions before we get to
All right.
our fun ones. But I thought we'd give you an opportunity. If there's something, one piece of advice or a message that you might want to say to the people that are doing this type of work every day, is there a message or a reminder that you hope that they carry with them when things get hard?
Yeah. Well, this just comes from my own spiritual values of who I am as a person. And I say one of the most important things we can do is live in a place of gratitude,
Mhm.
that there is something to be grateful for every day. And we need to find it and look for it. And if we're struggling with that, I always say start a gratitude journal. Just name 5 things every day that you're grateful for. And what it does is it starts to shift your perception to the good things that are happening around us. And I think it's important in this time where we feel so much despair around us is getting reconnected to gratitude. And there are good things happening, and we can't lose track of that. The other thing I would say is stay hopeful, and that everything is a time and a season, and it will pass. And I'm kind of a spiritual woo-woo guy. Eckhart Tolle is a couple books I've read of his that I really like, and one of them was The New Earth, and I read it many years ago, and I read it again during COVID. And it was an interesting read the second time under something that was so difficult going on. And I watched an interview with him, and in the concept of New Earth, it's really that we're evolving as a society and as a people to something better. And I was like, Are we? Are we?
Doesn't always feel like it.
And he had a comment that I stuck with me, and it's a nice visual for me. And he gave the visual of being at the ocean. And sometimes there are undercurrents that pull us back. And we're in a time where I feel there's this undercurrent that we're fighting against, and it's pulling everything it can back. But that momentum of pulling back also projects that wave to go further when it hits the shore the next time around. And I want to tell people that we are feeling that undercurrent right now, and we're fighting against that current because we don't want any harm to be done to the people we care about, to the communities we serve, and the people that we are locked arms with to hold the line. But I believe this undercurrent is going to give us momentum, and we're going to come back better, stronger on the other side of this. And we got to keep that vision of what we want to see the new world to look like, and as we evolve to. That's the message I really want people, is something good is going to come from all of this angst.
Excellent. Thank you so much. All right, we're going to move to a quick lightning round on a lighter note. Is there any TV show that you're into right now, or a book or a podcast that you'd like to recommend to our listeners, or what's helping you recharge these days?
Yeah, let's see. Well, I'm a big Brene Brown fan. I think you probably know that from your time at the Department of Health.
Yeah.
And she's just come out with a new book. I've just started it. So I love Brene Brown. I think it talks about our vulnerabilities and leaning in and not armoring up. And I think it's really important messages right now is not to get armored up and to stay in a place of curiosity and to really continue to ask the whys and understand that and kind of move in a good place. I just started, I'm only a couple of episodes into it, but the new show Boots is really interesting. And then, of course, it's got a gay character in it, and it's about the military. My husband is retired military, and certainly is it's fun watching it with him and kind of having this experiences, but enjoying that show, and it's kind of a fun watch. There's a little bit of drama in it, a little challenges in it, but it's a good escape and a good watch. And the song right now, as I mentioned earlier, is Have a Song. And I'm trying to find my why in this work. And David Archuleta, although it's a Christmas song, it's not really a Christmas song, but it's called Glorious.
Okay.
And in the song Glorious, he talks about the symphony. And he says, we all play a part, and there is music that we are all playing, whether it's in the healthcare system, the public health system, or the varieties of system. We all have music that we're playing. And the idea is figuring out what our part is and bringing that music together to really create this glorious symphony. And I'm holding that space is in this listening time is what is the opportunity of creating the symphony that really is about bringing people together, creating the harmonies, and really creating this beautiful music together that is really going to serve our populations in the best way possible. So that's the song I'm holding right now as kind of my theme song, is leading towards something glorious.
Great. I'm making notes for my Spotify list or my SoundCloud these days. Great. Thank you. I've also added Boots. I grew up on military bases. My dad was career military, and so I've also got a little bit of that context. Have you seen The Pit at all?
I haven't.
That one's been popular with my healthcare colleagues. It's like
Okay.
the entire. Yeah, it's called The Pit. It's on HBO, but it's
Okay.
the entire series is like 24 hours in an emergency room in the.
Oh, yes, I have heard about this.
Yeah, it's pretty good.
I'll check it
It's a
out.
binge watch.
All
right.
I'll check it out.
So, if you weren't working in public health, what other career could you imagine for yourself? What would you be doing if it wasn't this?
If I wasn't doing this, I think I really, my early years in public health, being a health educator, I loved. And so I would probably do something in the area of education. And based on what my experience is now, I'd love to be like a leadership coach or leadership development, and really help that people who are in those places is to be able to connect to their own power and help them find their strengths and their magic and bring that forth and really help change systems. Because I think sometimes our systems are challenging, and good leaders can navigate those and break those down and bring people along. So I probably would do leadership coaching or leadership development.
That sounds like a good fit. Yeah. And so, last question. What's one piece of advice you have for our future healthcare leaders, future physicians that might be in the thick of med school, grad school right now? Do you have a piece of advice that you would give them as they're entering the field?
Yes, my bit of advice is you've chosen your right field. And that, I have to say, and I did some coaching with one of my staff in a former place. And what this is my truth is that I'm so lucky to have found a career path that is more than a job, that I really feel it's my work. And I feel that I get to give back in some